right, 25 minutes before 11 o'clock. Thank you for tuning in. If you have questions about your eye health, this is a good time to call in and ask those questions. Zora Harrison and Nikki Nix are in the studio. They are here from Ocala Eye, and Ocala Eye has several different locations, so hang on to a pencil or some way to memorize what we're about to tell you, especially if you need an eye checkup, which they're gonna get on my case right now about not getting one. Zora is the Chief Operations Officer at Ocala Eye, and Nikki is the Patient Services Coordinator for Ocala Eye. Good morning, ladies.
Good morning.
Thank you for coming in.
Thanks for having us.
How have you been?
Wonderful.
So we have a question from somebody.
All right.
This is what does LASIK mean? What does it actually mean? Does it mean laser? I think was the real question.
Yes, we do use a laser for LASIK.
Is that what it means, LASIK?
No, and I do not know do you know what the
It's like
abbreviations are?
laser assisted.
Oh, it's an acronym for something.
Yes, it is an acronym.
Oh, okay,
You got us.
okay.
You caught us because I don't know what it is either.
I can see it. It's like in situ. I can't remember the whole acronym.
So, but what actually happens during LASIK surgery? What you use the laser to cut the cornea? Is that right?
Well, they can do both. You can make the flap, which is the incision that they're going to make. You can make that with a laser or with a microkeratome blade. So they basically are opening up the tissue, ablating or lasering off some of the underlying tissue, and then laying that flap back down.
Yeah, I actually saw my son have this done
that's
at
right.
your office.
That's what you said. I remember
Yes,
that.
and oh my gosh, I wish I could remember everything I saw. As a dad, I was so worried because he's an adult, and
yeah, absolutely.
it doesn't matter how old you get. That's what my mother always told me. Now I believe her.
That's right.
So what was I think they put like a dotted line on there so they knew where they were going. What is that? That can't be ink. What is that actually?
I've never assisted in a LASIK procedure, so I'd have to.
They do mark it with a marking pen, so that
That's amazing.
yes, they mark it with a marking pen, no different than you would mark another part of the body for surgery. So we do it in cataract surgery and other surgeries as well.
But it goes away, obviously.
Yes, it is, and it's basically just to help with what they call cyclorotation. So when you're sitting up, your eyes are positioned a certain way, and when you lay down, they can rotate into a different position. So obviously, if we're going to be treating tissue, we want to make sure we're treating it in the proper area, the proper space.
And now I have a question of my own. Now, if I'm taking you on a place you don't want to go, then we'll just go where you want to go. Okay?
Oh no, this is great. LASIK is great.
When you get a lens replacement, is it from a cadaver? Is that what they call it, a dead person? Is it like somebody donated their lenses?
No, the lens that you're having in cataract surgery, the IOL or intraocular lens, it's a fabricated lens.
They're usually
not a
silicone.
donor.
Oh, it's not real. Okay.
No, silicone or acrylic material.
Right.
Oh, wow. And people see perfectly when you put that in?
Well, if that's the only reason they weren't seeing was a cataract, then yes. I mean, there can be other
okay.
reasons that you don't accomplish perfect vision after cataract surgery, which we try to know all of those prior to going in and tell you about them. But yes, if that's the only reason you're not seeing perfectly, then that makes that clears the vision.
When people say they're leaving their organs, like the organ
Donation.
donor thing.
That's the cornea tissue. And we do have two surgeons
okay,
that do use the cadaver cornea tissue.
Really?
And very successfully as
Yes.
well. Very
People have
successfully.
corneal dystrophies or diseases that cause their cornea to have disease in it, and they need to replace that. So they can either replace all 5 layers of the cornea, or they can replace just internal.
layers.
Yes.
All right, now help. Okay, I think I know what the cornea is, but I'm not so sure. Is it the outermost part? Is
It's the
it
clear-
like the windshield or whatever?
Well, we do use that word, windshield.
Yeah. Oh, really?
It
It's the
is.
windshield of the eye?
It's the clear
Yes.
portion of the eye. That's
Okay,
right.
okay.
It's a protective surface.
Is it around the whole eyeball or just in the front?
No, sir. It's not the whole eyeball, but you have the corneal tissue that is pretty much where you can see the colored part of your eye, your pupil. It covers it there. The white part of your eye is called conjunctiva. But the cornea
Gosh,
tissue
this
is that windshield.
I'm so glad we have people who study stuff like this.
Me too. And when I started in this business, I thought this tiny little eye, how in the world are there so many specialists? I mean, we have retina specialists
Yeah,
and cornea
yeah,
specialists
yeah.
and glaucoma. How can one little tiny eyeball be so complex?
And it's such an important part of our
I
lives.
know.
It is.
I
Right?
know.
It is.
To be able to
Absolutely.
see. I mean, people who don't see, they figured out a way to live happy and and productive lives.
They
but-
do.
Yeah.
They do. I want to preserve it.
I got a phone a friend who it stands for laser assisted in situ keratomyosis. I knew it was something like that.
Still
but
over
couldn't-
my head.
Yes.
Hey, I
So it's
can't
an
even say
acronym
the
for
last
it.
word that she said.
So as trained professionals, when you look at that, what the words are that make up the acronym, does that say something to you? Does that describe what actually takes place?
It doesn't to me, but maybe more to someone that's assisted in LASIK, like Nikki has. I'm more on the administrative side, but no, I think LASIK is so commonly heard, though, and there's some misconceptions of what LASIK can do. LASIK is best targeted for patients that are only in need of correcting the distance vision. It cannot correct your near and distance unless you used something like monovision, where you set one eye distance, one eye near.
Ooh, that would drive me nuts.
Well, some people do that in their contacts and love it. So we do that in
Really?
LASIK. The other thing is that LASIK is not designed for people that are farsighted for the most part. Now,
Yes.
some patients, they do LASIK on what we call hyperopic LASIK. But for the most part, LASIK was designed for patients that are nearsighted. That means that they can take their glasses off and see very well up close. And then at distance, they need correction. They also are usually in that age group that they aren't going to be dependent on near vision correction. So now we have patients, though, that say, hey, I just want my distance corrected and I'll be
Right.
okay with reading glasses, and they love it. So we have 50-year-olds that would still need reading correction, but they love it because they can get up and go to the bathroom without their glasses. They don't have to mess with contacts. They can buy over-the-counter sunglasses. So LASIK is wonderful, and the healing time is incredible. Day one, they come in and they're like, oh my gosh, my vision is excellent. I drove myself here.
Most of them are already noticing a difference when they get up off the table.
Yeah.
I mean, it's pretty instantaneous for them.
It's very gratifying, I think, for the surgeons.
I mean, unless I had somebody tell me, and it would have to be you, that I had a need for surgery, I think I'd just go for the glasses.
Well, and that's part of what makes it, an elective procedure. Some people
cosmetic
are just
sometimes, yeah.
anti-glasses and they don't want to have to wear glasses or contacts for whatever reason. So, the surgical option is there
Or
for
if you wore
them.
them your whole life. Let's say that you enjoy scuba diving or you enjoy some sports, and you could benefit from LASIK and not have to depend on the glasses during sports and diving and things like that. I think that's most of the time it's people that say, I just get frustrated with my contacts. My eyes are so dry, or, the expense. I mean, when you look at it, the cost of LASIK versus 5 years of contacts or glasses, it's a neutral charge. So.
And for people who live very busy, either personal or professional lives, their glasses or contacts hinder their everyday activities. For them, it's very appealing because they don't have that concern.
Zora, when you said scuba diving, did you happen to see the story about hamster diving? Did you see this?
No.
We had a story this morning about 20 things you can do that are fun with your hamster.
Wow.
They have these hamsters in these airtight things at the bottom of the water. And then the game is you have to go down and get the hamster and bring it to the surface without it getting wet. And there's a technique to do that. And you put it in a little capsule and you get it to the surface.
Huh.
And then that's the hamster diving.
Never heard of it.
Yeah.
All right. Well,
It's always something
the first
new.
time for everything.
Always something new.
If a person receives LASIK, does that guarantee that they're not going to have cataracts then?
Oh, no.
No,
that's-
two totally different parts of the eye.
They will
Everyone's
get
going to get
cataracts.
cataracts. It's just part of the aging process. No different than people getting wrinkles or gray hair.
Yeah.
Comes with birthdays.
Oh, okay.
Is that right?
It is.
It is, but cataract surgery is marvelous too. I
Yes.
mean, patients
I want
come
to
in
old.
and
I want to be old. That way, I'm done with it. Just get over. It's because
No,
I'm in the
you're
process right now. It's just like I'm baking. I
you're
want
a
to be
spring
baked.
chicken for the average age that we see a day.
Yes.
So I wouldn't say that.
Can
but-
I ask price? How much is an exam cost?
Well, we don't take cash pay, so we take medical insurance. So
Oh,
for
okay.
most patients, it's just the cost of their refraction, which is $49. That's the prescription that we use to get your glasses and things like that. But the refraction does many more things other than just the eyeglass prescription. It tells the
Right.
doctor how well can you
Diagnostically.
see. How well, if we put refractive lenses in front of this patient's eye, what's their eye capable of seeing? And if it's not 20/20, then we have to figure out what's limiting it. Is
Right.
it the cornea? Is it the retina? Is it the cataract?
Oh.
So the refraction is kind of like the key to us at what your vision potential is. So, but for the most part, patients end up paying a small copay depending on their insurance and the refraction fee. And if you go to our optical shop, you typically get more of a discount than your refraction is because you're our patient. We're always giving some type of discount in the optical shop. So
Yeah,
for
yeah,
our patients.
So I'm not sure though what I do. So I just bring my insurance card with me?
Yeah, you literally just call.
Wow.
And you tell them what's
What
your
am I waiting
insurance
for,
card.
Barbara? Yeah.
I don't
And
know.
it's super simple. I mean, the exam on your first exam is long because we have to do all the medical history, kind of like what we talked about last time. Even though we're just your eye doctor, we have to know, is there anything we need to be looking for? Do
Right.
you have diabetes or high blood pressures or any
No.
other thing?
I found out I don't.
Well, that's
Well, very
great.
good.
Yeah.
That's great. And,
That's awesome.
and we uncover stuff that patients think they don't have all the time.
Yes.
So we hope that's the case. But the eye exam is like a window into your eye, so into your health. So if you have some blockages, we can usually see them in the eye and get you some
What
immediate
kind of
attention.
blockages? Like blood?
Well, there could be. There could be some blood, but you can have other things that show us that you may have high cholesterol or you may have some carotid artery
Fine with the
complications.
cholesterol. You know how I know?
That's good.
We donated blood. We donated blood
That's
on Saturday, and they gave us this whole report. It showed us that my cholesterol's good, the blood pressure. You would think a
That's
guy in my
awesome.
shape, I'd be horrible.
Hey, I have learned that not through obviously Ocala Eye, but you can never look at someone and
No,
judge.
you can't.
I mean, I just recently had heard about a young man in his 50s that was really fit and exercised and ate, healthy
You said
every
young
day.
man in his
That's
50s. Those
Trust me.
Our average age of patient is well over
That's
that.
like jumbo shrimp, right?
No, if you're a 50-year-old and you're a young patient,
Yes.
trust me. So actually, most of our 70-year-olds, they're young to us
Yeah,
too.
they are.
I mean, we love our patients.
What are
and
you,
sometimes they
angels? Like
spend
you're
the-
800 years old or something?
No, it's just fun. We love to hear about their life, and especially in the villages. We love to hear about all their tournaments and their pickleball and
You know what, though? That's really true about the folks who retire who think, okay, I'm just going to sit and watch TV. And then they just say, you know what? I'm not going to do that. I'm going to live my life.
They are very busy people out
healthy.
there.
Become active. You get make
Yes.
sure your eyes can see well again.
they do.
Yeah.
I totally agree. And they live different qualities of life.
Yeah.
I mean, we can tell the ones that live in a nice retirement community where there's activities and things they can do because
Can be involved in.
they're telling me, hey, I got to be out at 4 for pickleball
Right.
or, we've got a golf tournament this afternoon. So we love it. We love to hear how engaged they are. And so we say the 70 is the new 50 to us so in our practice.
And sometimes, the people are so worried about losing their independence when their
Yes.
eyesight starts to fail. They won't
It's
pass
very
that
scary
exam.
for them.
So you will do everything you can to
We
make sure
do.
that they
Yes.
still
We
are
do.
drivers.
Yes.
We do. We try our very best to keep them all healthy. And the one thing you can do for yourself is routine care.
That's exactly
And that's
right.
not just your eye doctor, that's in general. We encourage routine care. We catch more things on routine.
Yes.
I mean, by the time the patient calls us, we sometimes question what took you so long to call.
Yes.
So routine care is critical.
And that's a year?
Yes.
Or
For
6
most
months?
patients.
For most patients, once a
Oh,
year,
okay.
depending on what eye disease they have. If if they need to be followed more frequently than that because they have something else going on, then
The surgeon would tell them.
yeah,
Oh, okay.
Is nearsightedness considered a disease?
no,
No. Okay.
Just the way you are.
just how you're born.
Just the way you are.
Just
Well,
means your eyes longer than normal.
But what
so.
if you got it like as you got older? I didn't always need glasses.
Well, you're not nearsighted.
You're
for sure.
probably farsighted.
Oh, I'm-
I can
mine-
tell by your glasses
Mine
lenses
is
by
called
looking at them.
farsighted?
You're
Yes.
farsighted, yeah. And you probably have some latent hyperopia, like
Yes.
we talked about before, with
Latent
some
hyperopia.
presbyopia.
What is that? Latent hyperopia?
So your
Am I saying it right?
accommodation, you're saying it right. Your accommodation, and it's typical, it's normal. It starts to weaken a little, like everything else. So things that you were able to accommodate and see, you don't as
Like
well.
everything else.
But it's typical. I mean,
It
it's
is.
just normal.
It's normal for, especially once you hit that age of needing reading glasses, and that muscle that we talked about stops working, and it can't accommodate anymore. The need that you have for distance kind of rears its ugly head per se at that point in time as well. So you feel like you can't see anything distance or up close
you
when
know-
your whole life you've been able to see.
Do you know what I like about these conversations is that you talk in a language I understand. Once in a while, I need a glossary.
We learned We learned that from our surgeons
Yes.
because we would use terms trying to, because we've heard them say the diagnosis to us, and the doctor
Technical,
would remind
yeah.
us the patient doesn't know what
Right.
that is. You have to talk in non-medical terms because we want them to understand. So
Right,
I think
right.
we've just been trained from the core to try to
right.
speak
Well, that's
in a
really
language.
good. That's really good. It says a lot about your office. I had a little, it looked like a wart, but it was cancer on my nose. How many years ago now? 8 years ago, maybe?
Yeah.
Okay. And my brother said, that looks like cancer. You should get it looked at. Long story short, it was. And it was the simple one or the easy one, the good one, whatever.
Basal cell.
Yes. Well, you're so good.
We see those too on the
I
island.
knew it was an ingredient in pizza, but I couldn't remember which one. All right. So anyway, so I had this basal cell, and the doctor was really good, but he had horrible, what do you call bedside manners? Meaning he was really good and very sweet and a really nice guy, but I knew not a word of what he said. It was almost like he was speaking another language.
Sure.
And he didn't have an accent, so I'm not picking on that. But the lady was kind of like you ladies. When he left, she was the nurse, I guess, right?
Yeah.
And I said, I hate to ask you this, but what did he just tell me? And then she told me in real language, in my language.
It's important.
Right.
Yeah.
It is. And sometimes there is that communication barrier between physicians and their patients. And that's kind of what good support staff will do for them,
right.
is help bridge that connection, because for
Because
them,
we're not
everything's
medically
very
trained.
technical.
Yeah.
So that's just how they work sometimes. So
Yeah.
good support staff can kind of fill in that gap for them.
Do people need to have a separate pair of sunglasses? Because I know I've been thinking about that because I can't see at
it's
all.
a
So I was thinking
preference. I
about
mean-
getting a second pair, just the sunglasses, just for driving.
I mean,
yeah.
it's a preference. I think that, yes, for your type of prescription, because the sun windshield doesn't allow the darkness of the glasses to be as dark, and we're obviously in a really sunny state. So
Right.
for someone like you that just, really needs their glasses to see, and I can tell you
No,
guys.
I do. I can't.
Yes, you do. You're a pretty high minus. I can tell from here.
She's
Yeah.
nearsighted.
Wow.
That you're going to need them. I mean, that would help you, I think, because you could choose the darkness. And I always recommend, anytime you get glasses, talk to your optician about what you enjoy doing
And what you're going to
anything
use
that
them for.
frustrates you. Exactly.
So they can give you the proper guidance to
That's
give
right.
you the best pair
And they will.
to fit what you need.
okay.
They will, because that's their job. I mean, they're more than just selling you a frame. Their job is to know, how does this person use these glasses? What frustrates them or annoys them in their current ones?
Right.
How can I make their life better? That is the optician's job. And that's why our opticians spend about 30 minutes with each patient. I mean, I've had them be 45 minutes, but this isn't a 10-minute ordeal when you sit in the optical. It's really
Because
a
there's
get to know you.
different colors to your glasses. There's amber, there's blue, there's green, and you utilize those for certain things. So, it's really beneficial for you to get into what you're going to be utilizing them for, so that they can guide you to get the best pair that will fit you.
Like if you're a fisherman or something.
Absolutely.
You gotta kind of see
Correct.
what's going on
Correct.
down there.
Yeah, or golfer.
Golf.
Yeah.
Golfer's a big one.
Interesting.
Because of why? The glare?
Well, you want to see the green, so they have to give you a
Green and the white
contrast.
contrast.
Oh, oh, really?
Yeah, so you wouldn't wear the same sunglasses for fishing as you would for golf or skiing. We actually have, believe it or not, we have some skiers.
Water or snow? It
Snow,
doesn't matter.
and
Okay.
that's important, I guess. I've never been snow skiing, but I think it's important, right? That you see.
You get glare from it, just in a different way.
Yeah.
Oh,
So
okay.
we that all of our opticians, I love to brag on them. They're all licensed opticians, and
Very
this is
knowledgeable.
what they do. And so when a patient sits in their chair, they really want to tell you, how can I help you be better at what you do or enjoy your sporting events or activities more?
We're almost up to that time when people
I
from
know.
our area go to a ski place, aren't we?
I guess we are, but
Do you guys, do you ladies ski? Do you
I've skied once. Literally, I've lived in I was born here in Ocala. I saw snow for the first time last February. Did
you really?
In my whole entire life.
Where did you go? Where did you see it?
We went to Jackson Hole, Wyoming.
Oh,
It was beautiful.
There's probably
Nice.
a ton of snow
Yes,
there.
I almost froze to death, but it was beautiful.
I don't ski either. I'm not coordinated, so that would not be. I tried it once with my 5-year-old niece, and let's just say I went down backwards and she went forward. So, that was a long time ago, but no, I'm not a skier.
No, me either. I took my son once. We went to, he was also raised here, so I wanted him to see snow. So we drove north until we saw snow. And we didn't see any, so we stopped in Boone, North Carolina.
Okay.
And that night, it snowed.
Oh, how cool.
And it was snowed so much we couldn't leave.
Oh.
So we found a ski lodge there, believe it or not. I paid the money for him to take a snowboard lesson.
Yeah.
Oh, that's
And
cool.
it's a fond memory for me.
I
Yeah.
imagine.
Very nice.
You got to get them when they're young, because it's like I don't think I could learn now. I mean, just don't think it's possible. So teach them a little bit younger.
When people come here from out of state, Do you have a computer link to all of their records from their optometrist up north, or
We wish.
or like that, or how does that work?
Yeah, we do wish.
It worked out. That's the way it was designed or supposed to be designed. No, we typically depend on a record to be faxed or emailed
Right.
or sent because, patients that do what we call shared care. So
Yeah.
here they're here for the summer and there for the winter, or here for the winter. Excuse me, there for the summer. They're really good. They know what to bring.
Right.
They bring their last visit.
They're used to it at
they're
that
used to it.
point. They know what their physicians
Oh,
are going to
okay.
ask for to
Yeah.
see what this physician did while they were gone so that we can continue to follow that care and vice versa.
We do a lot of shared care in the
We do.
villages.
Oh my
We do.
gosh! Oh my gosh!
So, I have a question for Robin. When you got your glasses, did you use your insurance? Because you don't. You use your insurance card because it's not.
The insurance doesn't cover the eyeglasses.
I don't have vision.
Yeah. Most, even vision insurance, it does cover some, but
Right.
it's the basic. So most of the time, the patient needs something or wants something a little bit more than what the insurance covers.
Correct.
But for the most part, like in our practice, we don't take vision insurance, so the eyeglasses themselves are not covered.
Okay.
But
Yeah, and I remember you mentioned this
Yeah.
once before. So
I mean, the
Yeah,
glasses.
most optometrists are going to be where you find that
vision
take vision
covered.
care coverage.
But you
vision
should check
plans.
and see what do they cover that I need. 'Cause they're going to cover basic things you need, but that doesn't mean you're going to get the quality that you want.
Correct.
So a lot of times patients do opt out of the insurance because they want the lighter lens. They want you wear them all day, so you don't want a heavy, thick lens. You want a really thin lens that you see very good and clear out of, with lots of anti-reflective coating and the higher UV protection. And you want the very light frame that's not titanium, or you have a plastic frame, but a lighter material. And so most patients, because they wear them all day, really opt for those additional products.
But because you're ophthalmologists
Yes.
and surgeons, you can accept the medical insurance for everything, and then when it's time to actually get the glasses, then that would
Yeah.
probably be the only charge you'd have to worry about.
Correct.
Yeah, is the glasses.
Correct.
Yeah.
Yes.
Yeah.
Yeah.
And glasses,
That's wonderful.
for the most
Wish I
part,
would've
last
known that.
2 to 3 years. Now, we have patients that, their prescription changes because they're in this process of it changing, so it may change, but for the most part, the lenses and frames, quality lenses and frames are designed to last you 2 to 3 years.
Yeah.
Ocala Eye is where Zora and Nikki are from, and you ladies obviously know your stuff.
Well, thank you.
A good representation of the office. How many locations do you have?
We have 4 offices and a surgery center.
Yes.
And give a phone number so somebody listening who maybe has never gone.
Yeah,
or
I
needs to go.
encourage them to call and come see us. The 352-622-5183 is our main line. You call that line, and at that point, you're just going to kind of give them some information, and they're going to help you decide which location is closest to you or best for you, and then they'll also help you determine which doctor is most appropriate for you to see.
Really? Mm-hmm. Well, based on your eye count.
Yeah, so sometimes when you have histories of things, they're going to want you to see a specialist. For the most part, patients that call, they can pretty much see any of our ophthalmologists. But if we know for sure you had a corneal history that needs some, maybe a little bit more detailed information or testing, then we would probably put you with one of those specialists. But
And will you also speak to the family members? Because sometimes the person that's getting the exam, they're
Sure, yeah.
a little nervous and they want somebody else there that'll
we
comprehend.
love that.
Certainly,
We
yes.
encourage it.
Usually recommend, especially for anyone who is a little bit older, sometimes just having 2 sets of ears,
Yes.
because you hear different parts of the conversation, to remember what the doctor has told you or what the technician has told you. At least the 2 of you, can remember a majority more of the exam. And a lot of times when it's you in the chair and you're hearing diagnoses for the first time, you're so surprised by the diagnosis that you tune out a lot of what the physician's
That's right.
telling
Yeah.
you. So
I could imagine that. Yeah.
Yeah.
Thank you for coming in, Zora Harrison. Nikki,
Thank you.
Nikki Nick
Thank you.
from Ocala Eye. The phone number again, 622-5183. The website, ocalaeye.com.
Awesome.
Correct.
Thank you so much.
Thank you, ladies. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM.